So today's report is 1,745 new cases of COVID-19, our highest Monday ever. 197 of those cases are kids, 18 and under, and that's just today. We're now at 122,567 cases since March the 6th. Our positivity rate, 7.49%, highest since May the 5th. And remember, back in May, without as much testing as we have now, we were saying, make sure you're sick when you go and get tested. And we're now there. 1,133 Kentuckians currently in the hospital getting help for COVID-19. 300 in the ICU. It's the highest ever since yesterday. Just since yesterday, though this could be an effect of the weekend, but yesterday or Friday, it doesn't matter, 21 new people in the ICU and 142 Kentuckians on a ventilator. When we look at our new cases by county, Jefferson and Fayette still hit pretty hard. Jefferson, 372, Fayette, 255, Lee County, 94, Bell County, 61, Boone, 59, Davis and Kenton, 52, Pike, 40, McCracken, 38, Campbell, 30, Nelson, 29, Hardin, 28, Boyle, 25, Graves, 25, Bullitt, 24, Madison, 23, Warren, 22, Perry County, 18, Barron County, 17, Greenup, 16, Pulaski, 15, 14 in Oldham, Scott, and Shelby, 13 in Boyd, Knott, and Whitley, 12 in Estill and Monroe, 11 in Grayson and Hopkins, 10 in Henderson, Marshall, and Montgomery counties. Remember that Mondays are typically our lowest days and used to be our lowest by a lot because so many labs are closed on Sundays. Yet we have our 11th highest day ever, and it's on a Monday, which makes what's going to come this week pretty concerning, and we ought to brace ourselves for the numbers, because even with the efforts we're making, and we need to be making them, especially our Red County reduction recommendations, the results trail the numbers we see now, because it takes a little bit of time to turn things around. So remember, if you are in one of those red zone counties, you have got to be following these recommendations. This thing is already out of control, and this is your best option to get it back in control. But everybody's got to do their part. Now, if the school system is doing its part, but business and government aren't operating as virtually as they can, we cannot get it under control. If business and government is doing their part, but a school system isn't, and/or we're doing a lot of public events, we can't get it under control. It's everybody at the same time working together to do the things that we know that lessen the virus. It's not a puzzle to work out. We know the steps to take, but it is a team endeavor. And if the entire team in a community isn't doing its part, and in fact, some people are going against the recommendations, you can't expect to get it under control. More people will get it. More of your neighbors will suffer. So let's do the right thing. Let's pull our own weight. Let's everybody pull our weight to make sure that we are making our communities safer, because what follows high numbers of cases? More death. Today, we're announcing 11 new deaths. And again, Mondays are typically really low on that account too. It brings our total number of loss to 1,576 Kentuckians. People we love and care about, families that are devastated, people that need our help. Today, they include people in their 40s, 50s, 60s, 70s, 80s, and 90s. It's really starting to affect everybody, and it has been affecting everybody. Includes a 67-year-old man from Adair, 3 people from Bullitt County, a 66-year-old man, a 78-year-old female, and a 70-year-old man, a 43-year-old woman from Fayette County, a 50-year-old woman from Graves County, 73-year-old man from Greene County, 96-year-old woman from Hancock County. We lost 2 in Hardin County, a 95-year-old woman and a 92-year-old male, and an 81-year-old woman from Jefferson County. Long-term care facilities, where we had the virus really tamped down, but so much community spread that it's inevitable to get in unless a community can come together, follow the recommendations, and lower the number of cases. So 56 new residents testing positive, 59 new staff members. We've identified 34 additional deaths as being individuals in or around long-term care. A number of those from the Veterans Center in Wilmore. I think I have a question. We'll give you another update on that. But because of the amount of community spread, we're even losing our heroes that it's our job to protect later in life. Child care facilities, at least 12 new facilities have positive cases, 13 new staff, 7 new children in child care.